Welcome back, everybody. I hope you had a nice break, maybe stretched your legs or got had a drink and are refreshed and waiting for our next session. So what you're going to hear from us now is actually some of our partners with GB Health. So we'll hear from La Trobe University, we will hear from GOTAFE and Uni of Melbourne, and we have a video to show you. It's actually broken into 3 separate videos. So we're going to post to the chat in a moment those 3 separate videos. We're going to ask you to click on each one so that you can view them. There'll be some students that you see. There'll also be a terrific video looking at a piece of technology that's sitting with GOTAFE called Evie. So pay attention to that one. I'm sure you'll enjoy it. And then when you come back, we'll have a panel ready to answer any questions that you may have. Thanks very much.
So my name's Joshua Hughes. I'm studying my Diploma of Nursing here at GOTAFE Wangaratta. I decided to study nursing at GOTAFE. It's a local facility. It's got lots of facilities and I really enjoy studying here. I studied nursing specifically so I can make a difference in people's lives and to work alongside doctors, nurses, physiotherapists and making a difference. Being an inclusive environment, the diversity, the challenge is real and I'm looking forward to graduating with some new skills. Okay, so I enjoy studying at GOTAFE. Is the people around me are very inclusive, as I said. Yeah, it's a wonderful learning environment that you're able to just grasp your knowledge and take it further. My career dreams and aspirations are to further educate myself down at the university, which has been a 10-year dream for me, and it's been quite a challenge, and I'm anticipating that new step. Yep, you've got to be very interpersonal, autonomous, you've got to know what you're doing and be respectful, apply dignity and non-maleficence in everyday today procedures, seeing people's recovery and seeing how they progress through the stages of what they're experiencing. What I find challenging about being a nurse is knowing your stuff. You've got to know your stuff and that's what it boils down to. So I find most challenging is the assignments and the prep work that we've got to put into our, our exams and what comes next. And with the coronavirus, that's possibly put it up a little bit further, but no, everything's good. So campus life here at GOTAFE is quite exciting. You meet new people and the teachers are very supportive with any questions that you have.
Doesn't have to be 3 words if you can only think of it.
Absolutely amazing. So my career dreams and aspirations are to further expand my knowledge, take it further to the university level, and that's been a journey for me for the past 10 years. Where I've been too nervous to complete my uni, but I'm ready to take that beyond and take the next step. So the most rewarding aspects of being a nurse is the day-to-day procedures with your patients and seeing how they recover and what lies next for them.
Gloves. For your safety and the safety of the Sindava, please wear gloves at all times. Lift gently. Evie's limbs can be lifted and bent, but please be gentle and do not try to overextend or bend her limbs too far, as this can cause damage. Open her up to look inside, but be gentle. Evie's abdominal cavity opens up and her organs can be lifted out. However, as you will see when you are here, she is held together by stitches, and some organs have been deliberately left connected to their area of origin. If one or more of them does not come away easily, please do not apply force or attempt to remove them from her body, as it is likely we do not wish them to be removed, in order to maintain the Sindava's integrity. Evie, she's special. Treat her like the lady she is. This is all about Evie and her safety. In the name of politeness, if you need to sneeze, cough, or attend to anything else, please turn away from the Sindava. Treat her with the politeness and care you would give a client. If you have had to attend to other things or have touched an area outside of Evie herself, please wash your hands and put on a new set of gloves. Exposure. monitor her time out of water, and spritz every 15 minutes if she's been out for longer than an hour. If you have been the one to spritz her, please wash your hands and put on a new pair of gloves.
I wanted to be a nurse from a young age. I had an incident with my little sister, and just being able to help her, I think because it was my little sister, I felt very privileged, but just being able to respond in an emergency situation felt just really special, and I felt really strong to be able to do that.
I really enjoy seeing that link of critical thinking from their theory to their practice. It's when students actually start to be able to link their theoretical knowledge to clinical practice. Often it can take time and people work really, really hard to get the theory, but when it clicks in a practical sense, it's a really special moment.
From finishing my course and standing in front of a real patient, it felt so unreal. It was a little bit scary because I've got all of this responsibility now, but I did feel somewhat confident when I was interacting with my patients and they were asking me questions. I was able to answer them, and that felt really, really amazing. It was really good to be able to know that I do know my stuff and educate those who need it.
The passion within the health team is pretty remarkable. The after hours, the one-on-one times, the clarifying questions, the giving reassurance, the little pep talks that we give along the way. They go, you know what, you can do this. The smile that you see on students' faces when you just drop in and say hello on placement. Oh, I did this today. Oh, I did this. You know, it's sort of that extra mile. So I think that definitely sets us apart.
Nurses come to you with stories that they learn things every day, and I find that exciting, that no day will be the same, and it makes you want to see new things, learn new things. It's like a forever growing field. It's really exciting when we do come down here and we get to either practice on like each other or on the dummies. It's exciting. It's something different than just sitting in a classroom looking at a PowerPoint. There's that interaction. They help you learn. They're supporting that practice that you're getting to really like understand what you're doing.
What I love about nursing is your ability to help someone when they're most vulnerable. That's what's really special about it. Giving someone reassurance when they're terrified is just, it's a buzz.
I feel like there's so much more to learn, and it's going to be such a rewarding career.
Thank you, everyone. I hope you enjoyed the videos, and I'm sure you've got lots of things you'd like to know. And we have a variety of people on the call from La Trobe University, Uni of Melbourne, GOTAFE, and I'm going to hand over now to Angela, and she'll be able to talk to you a little bit about her role, and then there'll be some other panel members on the line as well. And remember that we are looking forward to seeing your questions in the chat and answering any.
Oh, great. Okay, so maybe I'll just, I actually work at GOTAFE, and I think I will just throw over to Kelly Gilmore and Alicia Thompson from La Trobe. And Kelly, maybe you can just have a bit of a chat about Diploma of Nursing at GOTAFE and what that involves for students that are thinking about doing that as for their career.
Yeah,
Thanks, Kelly.
Thanks, Ange. Hi, everybody. Happy Thursday. I work at GOTAFE. My role is the Education Manager of Health and Wellbeing. So I look after multiple qualifications. The Diploma of Nursing sits in that umbrella. We're really proud to say we have about 405 current Diploma of Nursing students across the region, right from Wangaratta right the way down to Seymour. Our students obviously do either a full-time 2-year course or a part-time 2.5-year course, and obviously complete clinical placement in a variety of settings throughout the region. We recently had a lovely, media opportunity with Win News on International Nurses Day that showcased one of our nursing students who was a local student here at Shepparton and began her journey working in retail, and then decided to start her diploma of nursing here at GOTAFE, studied locally and now works at Shepparton Retirement Villages in aged care. So with completing the diploma of nursing, obviously your employment opportunities are quite vast. They're not narrow. They extend right through from aged care to primary health care to acute care, and there's opportunities then to have an articulation pathway through to a Bachelor of Nursing and or complete advanced diploma units. So, you know, we look forward to any questions or inquiries here at GOTAFE, and I think what's really important is our current accreditation here is for 5 years, which we got last year with a commendation, and our trainers currently work in industry, which is really important for making sure that we're delivering training that is industry relevant as well as evidence-based at the bedside. So throughout COVID, there was a lot of changes to metropolitan training opportunities, but throughout COVID here at GOTAFE, we managed to keep our clinical labs running and finish all of our students, which was just an amazing achievement for a training organisation during a pandemic. So we welcome all inquiries and look forward to you coming and studying or starting your health pathway or journey here at TAFE, at GOTAFE.
Thanks, Kelly. We might also just hear from Alicia. Now, Alicia's from La Trobe, and she can talk maybe a little bit about the program at La Trobe and maybe some pathways from GOTAFE to La Trobe. Thanks, Alicia.
Thanks, Angela. Hi, everyone. My name's Alicia and I work at La Trobe, like Angela said. I'm based at the Shepparton campus, but I can talk across the programs at all of our campuses. So if you do want further information or if you want to sit down and have a chat with me, I'm more than happy to talk to you if you're wanting to go to Bundoora or Bendigo or things like that. So as Angela mentioned, we do have the Bachelor of Nursing at La Trobe. We have 2 entry points that would be suitable for those that are leaving school. So we do have the Bachelor of Nursing pre-registration program. So it is straight out of school. You can enter that program, or anyone that doesn't have a current diploma of nursing and isn't registered with AHPRA, this is a program for them. You complete the 3-year program, and at the end you become a Division 1 nurse and can work obviously in the field. The other option we have is a Bachelor of Nursing enrolled nurse entry, and that is for students who have completed their diploma and are currently registered with AHPRA. So the program works that once you complete your diploma through, say, GOTAFE, you do your 2 years there. You come along to us and it's an additional 2-year program to get that Div 1 qualification under your belt. It can be quite competitive, the process to go into the enrolled nurse intake, and it is available at all of our campuses. So just bear that in mind if you are looking at options of becoming a nurse. There are multiple pathways and entry points for you that you can enter into the program, and it's really great if you were to transition from the diploma at GOTAFE through to La Trobe. It gives you that background experience and knowledge, and you'd be able to work in the field while completing your bachelor's studies as well. So it's a great option if you are looking at becoming a nurse, whichever option you choose. We're always here to help you and answer any questions that you have. Great, I'll just throw back to Angela.
Thanks, Alicia. Now, there doesn't seem to be any questions. No, there doesn't seem to be any questions. I might just say too that GOTAFE, we offer nursing at Benalla, Shepparton, Wangaratta, and also our Seymour campus. So we have got a fairly wide coverage of areas for regional students. Okay, there's a question there. Can you tell us about your career journey? So maybe I'll ask Kelly to respond to that question.
Hi, Ange. Was that my career journey, or is that just one of the students' careers?
I think maybe about your career journey.
Yeah, absolutely. If that's what they want to know about, absolutely. So, okay, I've been nursing for probably about 28 years, and I started off with my Bachelor of Nursing after I completed that in New South Wales at the University of New England. I then went on to work in an orthopaedic ward and did my postgraduate in orthopaedics, and I found that really probably where I learned all of my really important head-to-toe assessment skills. But then I furthered my journey and worked in a private hospital, and then even further internationally, and worked and set up hospitals in the Middle East with a Canadian company in Abu Dhabi, and then went to work in the UK, and then on to Saudi Arabia, where I worked in a military hospital and for a private family. Then came back to Australia and obviously had a family and started my nursing journey at the Alfred Health, and worked for the Alfred Health in the orthopaedic trauma ward. Then had a family and moved out to Seymour and started my career here at GOTAFE, being the clinical placement coordinator and assisting diploma of nursing students to, I guess, follow their dreams and their passions in rural and regional areas, and ensure they were given opportunities that they wouldn't have usually been able to have. So, yeah, and then moved into an education role that I'm really passionate about, not just for nursing, but the whole of health and wellbeing, and making sure that our local communities are able to engage in training that or training opportunities to meet the workforce needs in our rural communities. So I hope that's answered your question.
Thanks, Kelly. That's fantastic. You've had a very big career there, doing a lot of different things. Now, also, can you tell us a bit more about Evie and how she is used? That was another question.
Yeah, sure. So we have particular subjects across the whole of health and wellbeing, including our sport and recreation subjects and qualifications, where there is a bioscience element that you will even be required to study when you head off to La Trobe. So our units are called anatomy and physiology units, and part of that is having a really sound understanding of anatomy and physiology and pathophysiology that underpins all of our medication administration. So, you know, in order to ensure that our students are having hands-on experience, we're not only delivering face-to-face, but they have an opportunity to work with Evie. As you can see, she's a live, a live version of a sim diver, and we also have what's called a 3D table that works with that. So all of our students have the opportunity to go across to Benalla campus and work with our lab tech, Louise, who you saw in the video, to offer, I guess, another learning opportunity for our students that is just not that traditional face-to-face training, but you actually get hands-on training with Evie in Benalla, which is just a really exciting experience. And Evie came from the United States, and I'm guessing, or I've been told, that she's the only one in Australia, and she's obviously submerged and lives in a tank. I know it sounds really strange having a name, but we're all really engaged in making sure that we are seeking other learning opportunities for our students. And having Evie located at Benalla means all of our nursing students and sports students and VETA students have the opportunity to be using that together, or further their skills in anatomy and physiology.
That's great. Thanks so much, Kelly. Now, I'm also going to ask Laura Kilgore. She also works for GOTAFE, and she's in the health area, and she might just give us a quick chat about dental nursing that we're now offering. Thanks, Laura.
Thanks, Ange. Hi, everyone. My name's Laura, and I'm a trainer and assessor at GOTAFE and delivering the Certificate 3 in Dental Assisting. So we offer this course as a traineeship model, and if you gain employment as a dental assistant in a dental surgery, you can undertake this course at GOTAFE. We have a custom-made dental lab at our Shepparton-based campus, which is really great for facilitating simulation and demonstration, as you would directly do in the dental setting. So we're really excited to be able to have that dental lab facility so that we can really put into practice your learnings. And yeah, like I said, it is only offered at the moment as a trainee-based model, so you would need to be employed. But if you had any further questions at all, in regard to the course, I'd be happy to answer any questions. It does run for 12 months.
Thanks, Laura. I think that's about all from us at GOTAFE. Now, unless there's any other questions, I'm just going to have a look. No, there doesn't seem to be any. So, Alison, I might throw back to you. And thanks very much, everyone. Appreciate everyone's input.
Thanks, Angela. Thank you all to all our panellists for providing your time and your expertise and sharing your career journeys with us. I hope that the students were able to hear the diversity that can come in the health space, and particularly around that nursing role. As you can see, you have a variety of careers available to you if you decide to take up a career in nursing. So this is coming to an end of our day that we are really pleased that we were able to provide this offering for you. It is online. It has been a virtual event, which is different to years gone by where we've had students come on site. We're looking forward to doing that again at some point, but just not right now. So thank you very much for participating. Thank you to all the careers teachers and advisors who I know have been supporting the event and participating with students right across the Golden Valley. Thank you to all our partners, so to GOTAFE, to La Trobe Uni of Melbourne, and to all of the partnering organisations who've supported GV Rural Health Day. To the LEN who have hosted the event in the background, we appreciate all your assistance and we look forward to seeing what 2022 will offer. We will be posting an evaluation survey that we're asking people who've attended the event to complete. It should only take you a minute or two, so you can see it there in the chat, and I'll send that through to all of the careers advisors as well today, so you'll have that. And any other feedback, please by all means get in contact with myself at GV Health. We do have our Careers Day Out website, and information from all of the events this week will be posted up there, so you'll be able to go back in and see the recordings. Thanks for your time and enjoy the rest of your day.